Good afternoon, and welcome to our third session in our first ever 55 and Better virtual expo. My name is Al Manzi. I'm president and CEO for Prairie Mountain Media and publisher for the Loveland Reporter Herald and the Greeley Tribune. Today's session, very interesting, is entitled Maintaining a Healthy Sex Life After 55. So before we start, I'd like to remind everybody at the bottom of your screen, there's a Q&A and chat feature that you can click on and enter any questions that you have during this session. Don't be afraid about entering them during the session so you don't forget. And then after the session, after our presenter is finished, we will have hopefully a lively question and answer period. Today's presenter is Dr. Michael Farrell. He's executive director at the Vitality Medical Center. So please welcome Dr. Michael Farrell.
Awesome. Hello, everybody. Thank you for taking some time out of you guys' day to come and hang out with us during this virtual 55 and up webinar. Just a little bit of background with me. I've been in healthcare for just over 14 years. Our practice, we've got a lot of different types of practices, but kind of my background has been in physical medicine and then regenerative therapy. But my wife and I saw kind of an underserved market niche that was needed in this area. We were watching, a lot of people that we knew kind of drive to Denver to try to address these issues. And so we thought it would be best to, build and kind of establish an environment here in Northern Colorado that could serve these types of patients. And so with that, I've got kind of a presentation prepped for you guys. I'm going to go ahead and click on over to this. Awesome. All right, cool. So this is Vitality Medical Center. Really kind of our goal is to help patients restore function, rejuvenate their life, and then kind of reclaim some of their vital, characteristics. Our goal is to help as many people as possible kind of live their life to the best, regardless of the effects of aging. Here's kind of a list of what we specialize in. We call it kind of him, her, and then hair. On the guy's side, we've got hormone replacement therapy, erectile dysfunction, cellular rejuvenation, hair restoration. Let me minimize this guy. Impotence, Peyronie's disease. And then on the her side, of course, we've got hormone replacement therapy, urinary incontinence, female sexual dysfunction, vampire facelifts and breast lifts, which is kind of a cosmetic procedure that's become very popular. And then full body cellular rejuvenation packages, and then kind of hair restoration as well. So what are the effects of aging that people see? The first one is kind of a change in their hormones. A lot of patients see hair loss, reduced sexual function, decreased urinary control, and then some of our patients see increased joint pain as well. So how does your body, how is it supposed to heal? Well, really what we're talking about is we're talking about your body's own stem cells here. So when you were younger, your body's stem cells were very active, and they kind of had the ability to do all these things. They can reduce inflammation, they can fight cellular death, right? They can differentiate into multiple tissue types, and then they can self-replicate. But the problem, so again, these are your stem cells, mesenchymal stem cells. They can turn into all these different types of tissue, okay? But the problem is as you age, the activity level of your body's own stem cells tends to diminish. So when you're a baby, the activity level is very, very high as you grow. And then, kind of at the 30-year mark, these are estimates, but this is pretty good stuff. And then the 60-year mark, a lot of the normal activity level of stem cells has diminished. So what that means is your body's own ability to repair things that have become damaged or aren't functioning as well has diminished as well. So there's a cool new technology. It's actually not new at all. It's been around really since people have been around. But there's been a breakthrough in terms of understanding how our body cells communicate with each other. and that's through these extracellular vesicles. So I've got about a 2-minute video here that I'm going to play for you guys on these.
In health and disease, our major goal is how do cells secrete molecules that influence other cells in a good way or a bad way. Exosomes collectively are a very powerful way, a new way of thinking how cells communicate long distance.
So when we're talking about exosomes, we're talking about really small bubbles that are released from cells.
It's much smaller than a bacterium, for example.
And you know that they're only about 100 nanometers in size, which is about 1/1,000,000th of the size of a hair.
Exosomes are blebs that are released from cells. They end up outside of the cells and can be isolated from the liquid.
It's been found in all mammalian cells that have been looked at. But one of the problems with exosomes is that they're very heterogeneous. There's very different kinds of vesicles, and it's been difficult to come up with a definition that encompasses all the different types of vesicles.
If you want to kind of envision what we're dealing with here, I guess maybe you should see Manhattan as one big organism with all these different cells. Every building is a cell, and then how do these buildings, how do they communicate with each other? And that's through these small objects that are running around through these streets. When you look here from the 28th floor, you see all these taxis driving around, but they're so small you can hardly see them. And I guess when you go really downstairs, perhaps when you take a big microscope, and all of a sudden you see that a taxi is much more complex than just a yellow dot. Actually, there's a lot of things going on in there.
Exosomes are supposed to be very powerful mediators. They carry all the signaling and the machinery necessary to go and change the behavior of a neighboring cell.
So there you go. You guys are all kind of cellular biologists now. So what really do extracellular vesicles do? The primary thing that they do is they work at restoring cell-to-cell communication. And really they're the primary kind of pancrean signal cell. So what that means is they may play a role in stem cell activation. Just so you guys know, these are currently in a phase 2 clinical trial for COVID treatment. You guys can check out this website, www.organicell.com, and that'll give you more details on how they're being used for COVID patients by getting their body's own repair mechanisms to kind of get going and play out. All right, so let's talk about erectile dysfunction. This is something that a lot of male people suffer from. You know, these are just some basic definitions. You know, it's when a man can't get or maintain an erection firm enough. And unfortunately, this can cause a ton of stress and strain in relationships and can result in low confidence. So one of the primary things that we need to address when we're looking at erectile dysfunction is testosterone levels. Now, a lot of people are aware of this, but a lot of people don't get their testosterone tested until very, very late. So, you know, when you're 25, kind of the normal ranges there are kind of a 300 to 1200 range. But typically by the age of 45, you know, you're only functioning on 60 to 65%. You know, for our 55 and up community here, we're down in this 50 to 55%. Now, as we're looking at this, the effect of estrogens, so plastics or estradiols in our environment, play a pretty dramatic effect. In other words, there's a lot of people out there who are running around with a lot lower testosterone levels than they realize. These are some of the symptoms of low T. Obviously, decreased sex drive. It can cause sexual dysfunction, infertility. These are the big things a lot of patients notice: emotional changes, strength changes, abdominal weight gain, depression, anxiety. It can also cause decreased bone density and heart disease as well. How do we attack erectile dysfunction? Step 1 is we look at balancing the hormones. Step 2 is we can use a procedure called PRP. We also use that in conjunction with pulse wave therapy. There's some exercises at home. And then there's actually some cool new peptides that are coming out that can be used to kind of get things going both for men and women. Here's a super cool video on how PRP works. I'm going to show you guys that.
PRP, or platelet-rich plasma, is a process where a person's own healing cells, the platelets, are employed to heal injuries in joints, cartilage, tendons, ligaments, and even for skin rejuvenation. Platelets are a basic component of our blood that leak out onto injured cells when a vein or artery is ruptured. The cells that are injured emit signals which let the platelets know where to go, activate and release growth factors that start the healing process. PRP takes advantage of this process in a very simple way. A small amount of blood is extracted from the patient, then centrifuged to exact only the blood's platelets and plasma, photoactivated with light, and then injected back into the area of injury. Normally, the body performs this treatment by itself, but sometimes when we get injuries in places where blood doesn't reach well or our tissue ages, we can help it by concentrating growth factors and stopping inflammation that can be painful and debilitating. Injured cells send off distress signals, attracting the activated platelets brought in through PRP. The new arrived growth factors now motivate the healthy cells to multiply and replace the injured or dead cells. The healing process is in full gear. PRP is an easy, quick, low-risk, non-surgical, and natural procedure we can use to shorten healing processes, lower pain levels, and reverse the effects of aging.
Cool, guys. So that was a little note on kind of how PRP treatments work. So how kind of we are really getting great results with patients with ED is using PRP, or sometimes we need to do a combination of the PRP and the extracellular vesicles. And really what that does is it causes a process called angiogenesis. Angiogenesis just needs, it means new blood supply. So the body goes in there and activates and causes angiogenesis to occur, which is new blood vessels can move into the area. The pulse wave can kind of stimulates the muscle, of the gland, which is the corpus callosum. And then we evaluate the testosterone levels, and we get them balanced if that needs to happen. And then we can also utilize peptide therapy, which can help restore kind of sexual desire in both men and women with the peptides. Our goal with this is to restore normal function so you can revitalize your relationship. It's more, you can think of the treatment strategy as not just, popping a blue pill to try to get something going with all those side effects and all those things. It's more of a let's get the gland and the organ functioning properly so that you can get back to, probably one of the most important things to you, which is your relationships. All right, so we're going to change gears a little bit and talk about some of our treatments for our friends on the ladies' side. One of the primary things that we're treating is urinary incontinence. These are just some crazy facts about it. Up to 35% of women older than 65 have it. Women under the age of 65, there's 10% that express symptoms, and they estimate that 25 million American women suffer from this. There's a new treatment strategy that's been developed for this. So there's these different types of urinary incontinence. We got stress, urge, overflow, and then functional incontinence. So what's our plan of attack with kind of a urinary incontinence? Again, we look at the hormones to see what type of factors those are playing. We can start with Kegel exercises, although most women have already tried that. There's a new procedure called the O shot that's becoming very, very popular because it's very non-invasive and easy for patients to do. It gets great results. And we can also do a procedure called tibial nerve stimulation if that's necessary. So here's a cool video on the O shot and how it works.
Heating up the love lives of women suffering from sexual dysfunction. The radical new treatment done locally claims it's helping get rid of the bedroom blues. Our Linda Hurtado is taking action for you tonight to find out if the O shot is for real.
So I had a hysterectomy around 6 years ago. I've noticed a lot of different things with my estrogen changing.
More than 40% of women suffer from sexual dysfunction. at some point in their lives. Myrna Rogers is one of them.
Zero desire as I've gotten older. I'm very dry. It's very painful.
Enter a miracle injection. The O shot is a new non-invasive treatment that aims to help women with 3 problems. 1, pain with intercourse. 2, urinary incontinence. And 3, enhance sexual pleasure. How? By extricating PRP, or platelet-rich plasma, from a woman's own blood and injecting it straight into the vaginal area.
Basically helping the body to regenerate new, younger, healthier tissue. As we age, our muscles throughout our body age, they weaken, they atrophy. Same thing with the sexual organs.
I have to ask for my viewers, is this a little painful? Is there, I guess, the pain before the pleasure, so to speak?
We numb the area very well.
It was quick and painless. I actually did not know when they started.
Michelle is an out-of-state patient who flew into Tampa in March to get the O shot for urinary incontinence.
Definitely took care of the symptoms I was having, and it improved everything. It helped with, within.
Awesome, guys. So that's kind of a 101. I'm obviously male. I've had other procedures done, but some of my very, very close people in my life have had the O shot, and they described it as being painless. It's very, very easy to do. There's very particular ways that we kind of numb that area to make it painless, and it can work really, really well helping patients with incontinence, and then also something called female sexual dysfunction, which is just having some dryness and things like that as we age. This is another very popular thing that sometimes some of our patients need called tibial nerve stimulation. Let me show you this.
Uroplasty Urgent PC, office-based neuromodulation for overactive bladder. Bladder function is a complex interaction between bladder, brain, spinal cord, and peripheral nerves. These interactions coordinate urine storage and elimination. For men and women with overactive bladders, this coordination does not work as it should. Bladder nerves continually send signals to the brain that the bladder should be emptied, even when it's not full. This causes the bothersome overactive bladder symptoms of urinary urgency, urinary frequency, and urgent incontinence. Neuromodulation delivered by the Urgent PC system is a non-drug, non-surgical method of modulating overactive bladder signals. During this office-based treatment, the patient sits comfortably. A very fine needle electrode is placed near the tibial nerve and attached to an external stimulator. This procedure is called percutaneous tibial nerve stimulation, or PTNS. Mild electrical impulses travel up the tibial nerve to the sacral nerves, which are responsible for pelvic floor function and voiding. Stimulating these nerves quiets the overactive bladder, reducing inappropriate bladder contractions and the number of signals sent to the brain. This results in less urgency, frequency, and urgent incontinence. Urgent PC works gently and gradually to improve bladder symptoms through a series of 12 weekly 30-minute treatments. Up to 80% of patients see significant improvement in their symptoms. Data suggests that Urgent PC may also induce changes in the part of the brain that is involved in normal voiding. As a result, patients do not need constant stimulation.
So that's kind of a 101 on tibial nerve stimulation. That needle is very small. You can think like an acupuncture needle, so most patients don't even feel it when it happens. So the other big challenge that a lot of our patients are seeking out is hair restoration. And I know typically this is associated with a lot of men, but believe it or not, a lot of women, as they age, they get the thinning of the hair, particularly in the side areas or sometimes in the back, and it can be very embarrassing for them. So yeah, it is possible to use regenerative cellular products and PRP to stimulate hair growth back into those areas. What we find is that the follicle is still present, but that it's dormant. And so by kind of getting that follicle to reactivate, you can get hair growth happening as well. So again, we use regenerative cellular products that can activate the body's own stem cells at the site of the follicle. and that can kind of stimulate follicular activity to get that stuff going again. Here's kind of a fun video on PRP and hair restoration. I'll show this to you guys.
My wife has informed me I've been thinning on the crown. It's the classic male pattern balding, hair follicles going dormant on the crown of Ron Woody's head. But hair loss is a problem for women too.
When I'm in the shower, it comes out. The banks in front was all gone.
Camilla Singh has what looks like a very full head of hair, but she noticed her hairline in front was receding and she was losing hair on top too. And neither she nor Ron wanted a transplant or lifelong medication use to hang on to their hair. So Camilla came to see Dr. Bruce Katz, who explained she hadn't actually lost her hair follicles.
They're actually still there, but you might see a little peach fuzz, but they're basically dormant.
To wake up those sleeping follicles, Dr. Katz and others have turned to platelet-rich plasma, or PRP. First, some blood is drawn from Camilla, which is then spun down in a centrifuge to separate out the platelets in the plasma. Then the platelets are activated, so they can secrete the compounds that are thought to be responsible for hair growth.
They actually produce new stem cells in the root of the hair follicles, and this sort of wakes up the hair follicles and they start producing hair again.
The activated PRP is injected into the areas of the scalp where the hair is thinning. This particular system uses a kind of matrix that keeps the platelets in place for up to 7 days, so the growth factors have a chance to really work. Hair regrowth results have been published for both men and women. Camilla's had a few treatments that grew back her hairline, and Ron had 4 treatments a month apart, and his hair growth is clear.
More importantly, what'd your wife say about it? She was quite pleased.
Cool. So sometimes, depending on the severity of the thinning or the baldness, we may, again, combine some of those extracellular vesicles if necessary in there. This is another cool thing that we're also utilizing for patients. It's LED therapy. LED is a low-level laser. And really what that does, again, it just helps stimulate the hair follicle. The cap is worn at home. And typically most of our patients just rent that during their hair restoration kind of period of time. Awesome, guys. Well, that's kind of all I have for today. I know we're going to jump into kind of a Q&A session now, I believe. Before we do that, I wanted to give you guys kind of a gift to those of us who have taken the time out of their day to come and hang out with us for a little bit. The first thing is we do free consultations on all the different types of things that we discussed today. You can come in and speak with one of our providers there and one of our case managers to see if it's a good fit for you. For our 55 and up crowd, we're going to give you guys a 15% discount off of your procedures. And then kind of as a special thing that I wanted to do just specifically for this webinar is the first 5 patients that decide to sign up for a consultation, we're going to give you guys a free pulse wave session as well. Those are a $75 value is how much the pulse wave sessions are. So that's an opportunity for you to try out, you know, what a pulse wave could do kind of for you. Here's kind of our contact details to set up your consultations. There's our phone number, email, and then of course you can always just pop us up on the web as well. And then are we going to jump into kind of I think we're going to jump into kind of our some questions now. So I'm going to stop sharing my screen now, I believe. I don't really know what happened.
That's right.
Okay, perfect.
We'll get into some questions. So I'll start off. Can HSA be used for any costs associated with sexual function or other related issues like that?
Yeah, HSA is not an issue at all. Some of our incontinence procedures can be billed through insurance. Unfortunately, most of the erectile dysfunction procedures are considered to be elective. So they're not able to be billed with insurance.
So unlike a facelift or something like that, sexual dysfunction treatments you can use your HSA for that.
Yeah, the HSA is not a problem.
Cool. That's great information. Could you spend a little bit of time talking about testosterone? You know, people hear all kinds of stuff about testosterone. You know, are there any risks associated with testosterone therapy? And what's normal testosterone levels for, because you hear all kinds of levels. Oh, you have low T. Well, what is low T, and clinically, what does it mean? And then, or is it really related to what's normal for you? So maybe you can kind of talk a little bit more about that.
Yeah, so testosterone therapy has been used for many, many years. The normal range right now is 300 to 1200. They actually just redefined it because so many men now are coming in with low T. It used to be, the lower number used to be higher than that. The reason why testosterone is becoming such a problem is, everything in our environment typically is plastic. I'm sitting at my other office right now, and in this room, it's like got furniture that's got varnish on it. Anyways, all those plastics emit a thing called an estradiol, and the estradiol binds to testosterone and doesn't allow it to do its job. So there's some people who say, well, what's normal for you? What's normal? I always ask people, well, how do you want to function? What level do you want to function at? Because it's possible now for you to have testosterone levels. Most of our patients like to be around 900 to 1,000. That's where they feel the most energetic. They're able to put on muscle mass. Their sex life typically improves. All those types of things. And we're seeing guys. In the office, I know that the providers over there have seen, people in their mid-20s now with testosterone that's in the 400 range, which is ridiculously low. So these are factors that we're going to continue to see with testosterone.
And so, how often should you get your testosterone checked if you're concerned about it?
Well, if you're on testosterone therapy, you need to make sure that you're following whatever your provider's recommendations are. So our patients that are on testosterone therapy, we typically check them at a 3-month mark, and then 6 months, and then every 6 months after that. If you've never had your testosterone.
Will those patients be on testosterone therapy the rest of their lives?
Well, it's up to them. A lot of patients feel really, really good on the testosterone therapy. And so, it's a choice that they can, kind of continue to make for themselves. You can wean off of it, if you don't want to do it anymore. But,
and are there any cancer risks or anything like that associated with testosterone therapies?
Most of the cancer risks and things like that you hear about are typically through estrogen type therapies. So typically not, especially for our male patients.
And so can you talk a little bit more about how you use PRP and how that improves blood supply?
Sure, yes. So PRP, kind of the way to think about it is if you cut yourself, those platelets are going to migrate into that area. They actually release kind of the cell signaling, like what we were talking about in the beginning. And that tells the body that, look, new blood vessels need to migrate into that space to start to heal that tissue and help it get better.
And what's the cost of either testosterone therapy, like if you were on a monthly program, or PRP therapy? Is PRP therapy continuing, or is that a 1 or a 2 or a 3 time treatment and then you don't need to come back anymore?
Yeah, so typically it depends on the area that you're trying to treat. So for patients with incontinence or sexual dysfunction, typically, that may be, 1 or 2 treatment sessions. For guys who have erectile dysfunction, a lot of times it really depends on how long they've had it and kind of how severe it is. We've had patients that, that haven't had an erection in 10 plus years that we're getting results with by using these types of therapies. So cost is going to depend on how many sessions you need, and then what else you need to get it fixed.
So let's just talk about cost of testosterone therapy. What would that average per month?
It's going to be around $200, including the labs. We include the labs as part of our club membership because to us, you have to be monitored. There's some gyms in town and things like that aren't doing a really good job with this. So that I mentioned that it's a continuous monitoring process.
Can you talk about diet, exercise, and supplements that might also help with some of these issues?
In terms of diet and exercise, you can always talk about, carnivorous, green vegetables, balancing your lipid profiles. Exercise is cardiovascular and weight training. These things are pretty well versed. the main thing is you got to, these parts of our body are like a muscle. You got to continue to use them, or you kind of lose it. So for patients that have kind of lost that area of functionality, you can get it restored now and then, kind of maintain it.
And what about supplements? Are there natural supplements that you can do to help testosterone and any of these other issues, both men and women?
I mean, there's some natural, like, kind of T boosting supplements, but typically what they do is they just activate one path of testosterone. They usually don't pop the overall levels. Sometimes they can just free up some testosterone. So I'm not a huge fan of it because the results seem to be all over the place.
And if you're, very often if people are on, say example, Kaiser, when you go to the doctor, they won't do a testosterone test for you. So typically you're going to have to go to a vitality clinic like yours, or pay for that testing on your own, correct?
Yeah, that's very common. Depending on the insurance companies and the climate, they don't like to treat patients unless they're subclinical, which is typically under, that's a 300. Normal goes clear up to 1200. So it's like on that scale, you're way the heck down here. So a lot of our patients, in this type of environment, they're very interested in maintaining their active lifestyles, all the things that are important to them, golf, muscle maintenance, their sex lives. So they like to function on the higher end of those things. So, so you're right. Typically they don't like to order testosterone tests. They don't want to manage it.
Can you talk a little bit about, for men, weak urine streams and things like Flomax and the side effects of some of those treatment options?
Yeah, I can't speak very much to the side effects of Flomax, but I will tell you the urine streams a lot of times can come from stress incontinence in men, which is something that happens a bunch. And then also, again, if you're not using, if the penis is just in essence becomes something that you pee out of, you've got to get the corpus built back up to kind of deal with some of those issues.
Cool. And that's so there's some prostate issues in there too, correct?
It can be, yeah. Our providers check all that stuff so they can identify it.
And so can you talk about the O shot and what that might cost for a woman?
So typically the O shot's packaged with other things because a lot of times just it depends on what they're trying to do with the O shot. Like some of our younger patients, they've just got a little bit of stress incontinence and they're trying to just regain some health and vitality after having kids. Some of our older patients have more severe types of incontinence. So sometimes it could be combined with other types of hormone therapy. Those may be creams. Sometimes we may use the pulse wave in those areas, or we may need to use that tibial stimulator as well. I think an O shot, if it's just an O shot, is right around $800.
And so do you also prescribe things like the enhancement pills that men can take? Do you also prescribe those?
We haven't needed to. And I don't, just so you guys know, I don't work in the clinic at all. I'm not a provider there. We have other providers that are on site there. So typically they don't prescribe those types of things. You're going to see kind of the next big buzzword in kind of these industries is going to be peptide therapies. Sometimes we'll prescribe peptides.
Could you talk about peptides? I didn't really understand that. So if you could talk about peptides.
Peptides are hard to understand. It's another way for the cells to communicate, kind of that cell-to-cell type communication. And, so it's just a protein that could be used either with a nasal spray or they have, just a very small injectable. But there's all different types of peptide therapies out there. Some of them are designed to help with growth hormone. Some of them are designed to help with collagen deposition. Some of them are designed to help with sexual desire. But they have a very different mechanism of action as opposed to just a vasodilator, which is what you typically see with the blue pills.
And so are there risks associated with peptide therapy?
No, that's what's nice about it is it's more of a natural substance. So if your body doesn't use it, you just, kind of pee it out. Some of our patients, they get a little too excited about the nasal sprays. And so, sometimes they'll use more than Kelly prescribes. And that can cause a headache if you overuse it, but that's pretty rare.
And so can you talk a little bit more about the hair treatments, the PRP and the light treatments that you're using? What percentage would you say are like, if you said, okay, 100% means I'm going to treat every balding person or thinning hair person is going to see significant hair growth versus 20% or 50%. So what kind of success rate are you seeing with those treatments, both the LED and the PRP?
Well, it's a combination.
So use them together.
Yeah, you got to link it together. And then some patients, if they've got severe balding, we'll link the extracellular vesicle treatments as well, or other amniotic products. But yeah, it's better than 80%. If you've been bald for multiple years, where it's not like you're shaving the thing, but where you're, what am I trying to say? You're waxing the top there, that thing's super shiny, then that's going to be much more challenging. We typically don't, take patients like that. Our favorite are the ones that are thinning, or where they have spots or areas, like maybe they're thinning here, or really, really big spots back here. Jimmy Lakey's a big fan of ours. We've been working with him. I don't know if you guys know Jimmy, but he's got, some pretty good patterning going on. And we've had some great results with him so far.
And so the PRP are injections in the scalp?
Yeah, there's, numbing creams have come a long way. So there's a numbing cream, and then there's actually a kind of a ring block that our providers will do, and that it numbs that area. So, and it's a very small, it's a super small needle. So most of the injectables, I tell patients, don't worry about it. I don't like injections. I've had these therapies done myself, and the numbing creams are just nothing short of phenomenal anymore.
Cool. Excellent. Just check here. Let me see what other questions. So I guess the most important thing to remember is that most people are going to experience this, men and women, through as they age, and they should address them, as opposed to in today's world. Obviously, from what you've demonstrated today, there's so many new things that can dramatically improve their life, the satisfaction of their life. They should make this call and check it out and see what's available to them and what makes sense for them.
Yeah, I mean, that's really what's happening is, these things are changing all the time, especially, in this field of regenerative medicine, and these types of, procedures and products weren't even available several years ago. And all of a sudden, they've been out there, they've got, really good safety records, and the effectiveness is nothing short of phenomenal. So I always tell people, it's like, well, anymore in today's environment, how you age is really kind of a choice. There's so many different things that you can do to really facilitate, different types of aging. We really feel like this is an area, especially in northern Colorado, around this area, that's not being addressed. The people aren't dealing with it. So yeah, it's kind of a him and her concept. A lot of our people come in, maybe he's got some erectile dysfunction, and then, we get results with him, and she's like, hey, I need some help as well. And that's typically, how that goes. So.
And we didn't talk at all about the vampire facelifts, but I'm curious about how effective they are, how noticeable they are, how much pain someone might go through, what the recovery time is, that kind of thing with vampire facelifts.
Yeah, the vampire facelifts, I mean, you guys can Google that. The Kardashians are probably the most well-known in terms of, I probably shouldn't have said that. I'm sure I just violated some trademark.
They're going to sue you.
I know, seriously. They're probably the most well-known in terms of kind of promoting the vampire facial. The vampire facial uses a microneedle, and then it works with the PRP. Again, the area is numbed, right? There's numbing creams that are used beforehand. And then the microneedle is like a millimeter, maybe a millimeter and a half or 2 millimeters, and it re-injects all of that. So for people that have been doing, Botox or other types of fillers, the PRP facial is much more natural, and then you can use it in a lot of different areas. A lot of patients do it pretty much all over their face. Recovery time on that, it looks like you've had a sunburn, and that lasts for about a day to maybe 2 days. And then the real effects of the PRP facial will go up through 6 weeks and then on. So some patients need multiple, some they just want one.
And what would a vampire facelift run?
I'd have to look. I don't know off the top of my head.
That's fine.
Pricing.
That's always one of the most common questions we get is what does it cost? So
Yeah.
I always add those in.
Yeah, I think it's going to be, I think a vamp is either $400 or $600. A lot of times what we recommend for people is it's like, just pop in for a consultation, spend 20 minutes with one of our case managers, and then they can match, our treatment strategies with your goals. Some people think, well, I just want a vamp facial. It's like, well, what are you trying to do? What really are you? Well, I want to get rid of these 3 wrinkles, or I'm trying to improve the bags under my eyes. So a lot of it just really depends on, we're big into matching patient need with service centers rather than trying to say, well, we're selling you a vampire facial. It's like, well, how do we improve your whole complexion if that's what you want? So that's why those consultations, are really kind of the best path.
And you're doing, and at your clinic, they're also doing, or that clinic, they're also doing other types of skin related treatments as well for men and women, correct?
Yeah, they do Botox. There's a vampire breast lift, which is pretty popular. There's all kinds of microneedling treatments, all those types of aesthetic type treatments.
Excellent. Well, Dr. Farrell, your information was fantastic today. Really, really enjoyed it, and I'm sure everybody in the audience today really enjoyed it, and we'll be hopefully thinking about some of the things that can improve their lifestyles. So we thank you so much for your presentation today, and we wish everybody a good day. Thank you.
See you guys.
Bye-bye.